This video is for patients having surgery for a problem in your liver, pancreas, gallbladder or biliary tree at the Royal Free Hospital. You will be looked after by a highly trained, caring team who are working together to give you the best possible treatment.
Well done.
Your care will follow the Enhanced Recovery After Surgery pathway, or ERAS for short. ERAS represents a new way of thinking about how we look after patients undergoing major surgery. It helps patients recover from their operation sooner, so that life can return to normal as quickly as possible. ERAS is a treatment programme made up of a number of different elements based on the best available medical science and focuses on making sure you are actively involved in your surgical journey from start to finish. By the end of this video, you will understand how the ERAS pathway works, know what to do to prepare for surgery, know what to expect when you are admitted on the day of surgery, know what to expect immediately after surgery and during your hospital stay, and know what to expect about going home and how to be active during your recovery.
Hello.
You will already have had an appointment with the surgeon and seen a clinical nurse specialist at the Royal Free Hospital who will have advised you which operation you will be having, what to expect before and after surgery, and what to expect on discharge.
So this is a booklet about enhanced recovery.
You will also be given an information leaflet about our ERAS programme.
You've got my contact details.
The clinical nurse specialist will give you their contact details so that you have a point of contact if you have any questions or worries at any time between appointments. Please use these contact details rather than sitting at home worrying.
Yeah, let's get it done. Yeah.
After seeing your surgeon and CNS in the surgical outpatient clinic, you will be invited to attend the preoperative assessment clinic. We will aim to accommodate your pre-assessment appointment on the same day, but sometimes you may need to return on another day for other tests.
It requires that you're put to sleep.
In the preoperative assessment clinic, nurses and doctors will review your medical history and your medication history and check if your health can be improved to minimise your risk of complications after surgery. You will have an opportunity to discuss your anaesthetic plan, your pain relief plan, and potential risks associated with your surgery with a consultant anaesthetist.
So these are the body wipes.
You will receive information on preoperative hygiene, fasting times, and managing your medication if this is required.
Plenty of water, all that
It is important that you follow the medication advice, as your surgery might not be able to go ahead otherwise.
So these are the pre-op drinks.
Unless you have diabetes, you will receive pre-op carbohydrate drinks, which we ask you to consume on the evening before and early morning before surgery. This is to minimise the side effects of your fasting time before surgery.
Hello.
To help you prepare your body for surgery, you will be referred to the My Integrated Lifestyle and Exercise Prehabilitation team.
Just wanted to talk to you today about a bit of exercise.
They will support you to increase your fitness and nutrition before surgery. The evidence tells us that preparing your body well for surgery can reduce post-operative complications and help reduce your recovery time so you can get back to the things you want to do more quickly. You will first receive a telephone call to assess your current level of fitness and talk to you about joining our virtual exercise classes. If you are suitable, you will then be able to join our exercise classes online twice a week with other people going through a similar process to yourself.
Welcome to Eat Well.
You will also attend a group talk with a dietitian. They will provide you with information about how to eat well before surgery, and it is your chance to ask any questions about nutrition you may have.
So guys, I just wanted to also check if you had, if any of you were using the AIMS shake.
If you have recently lost weight or have been identified as someone who could do with some extra nutritional support, you will be started on nutritional supplements at your first appointment.
Inside the box.
It is vital you take these as recommended, as you want to be as strong as possible going into surgery. You will have a telephone consultation with the ERAS specialist nurse to talk you through the process of the pathway.
My name is Lucy. I'm calling from Royal Free Hospital. How are you?
Prior to this call, you have had time to read through the ERAS booklet that was given to you in clinic, so please ask any questions you have.
Anything that gets me through the operation, I'm happy to do.
So with the liver resection that you're having, we're aiming for you to go home on day 5.
In this call, we will also discuss how long you are likely to stay in hospital. The doctors will keep a close eye on you and will discharge you as soon as you are ready to go home, usually around day 5 for liver and day 7 for pancreas.
Thank you very much.
This may be earlier or later depending on your recovery.
Yeah, okay, thank you. Bye. See you on coffee.
I'll have a small coffee, please. That'd be lovely.
In the days leading up to your surgery, it's important to prepare your home for when you return afterwards. Although we want you to start doing your usual day-to-day activities, your body will still be healing and you may feel some discomfort. So to make life as easy as possible for you when you get home, here are some top tips. You won't be able to do any heavy lifting for 6 to 8 weeks after surgery, so try and move anything you might need into an easy-to-access location. Do a big food shop, stock up the freezer and think about cleaning and changing your bed sheets. Make sure you have a good supply of your regular medications for a few weeks. You might need some extra help with things like shopping, cooking and cleaning after surgery, so have a think about friends, family or anyone else who could support you as you recover. There are also charities like the Red Cross and Age UK which can provide help, so look them up if you need them. Patients often ask what they should bring to hospital on the day of surgery. We suggest comfortable clothes, trainers or sturdy shoes, personal toiletries, glasses, hearing aids or contact lenses, medications in their original packaging, mobile phone and charger, change for newspapers or other small items, a coat and house keys, and things to keep you occupied like books or magazines. Please don't bring large amounts of money or valuables as the hospital cannot take responsibility for their safety. Please don't wear any nail varnish or false nails, and alcohol and smoking are not permitted in the hospital or in the hospital grounds.
You alright?
On the morning of your surgery,
It's fine. Are you coming from far?
please arrive on day surgery ward at the specified time.
Which one would you prefer?
There you will undergo routine checks to ensure you are ready for your surgery. This will include checking your fasting time and whether you stop the required medications, so please remember to adhere to the information and advice provided to you in the preoperative assessment clinic.
Yeah.
You will also meet your anaesthetist. They will discuss the anaesthetic plan with you.
Hello, Kevin. Hi, good morning. Good morning. How are you?
Before coming to the operating theatre, you will be reviewed by your surgeon who will re-discuss the procedure with you and confirm your consent to go ahead.
We do a consent for the operation. We talked about the operation.
The day of surgery, nursing staff will keep you informed of the operating theatre schedule in case any delays occur. Before we can proceed with your complex surgery, we need confirmation from our intensive care unit that a bed will be available to look after you closely after surgery. You may want to bring in something to keep you entertained in case you need to wait, and please ask a nurse to store any of your valuables before you go for your procedure. As you are aware, the liver and pancreas surgical procedures are complex, and your anaesthetist and their team will ensure you are very closely monitored during the operation. So you will have some lines and drips inserted whilst you are asleep.
Hello. Okay. Welcome to
After your surgery, you will be transferred to the Enhanced Post-Operative Care Unit, or EPIC for short. Your anaesthetist will wake you up either at the end of your surgery in theatre, or, if your body needs more time to recover, they will keep you asleep and hand your care over to the intensive care doctors. EPIC is an area where you will be cared for by nurses and doctors with specialist skills in post-operative care.
Okay, so oxygen is connected. Let's just put the monitoring on.
They will continue keeping a close eye on your breathing, heart rate and blood pressure via specialist monitoring equipment. You will have some extra drips in your wrist and neck for monitoring purposes and to allow us to take bloods without using needles.
Kevin, I'm going to give you this pain medication button. This is called the patient-controlled analgesia.
You are likely to have some pain after your operation, and we will give you pain medication to manage this effectively. You will have already discussed the type of pain relief you will receive with your anaesthetist before your operation. This could be an epidural or a PCA, which allows you to be in charge of your pain relief. And by pressing a button, you will receive a dose of a painkiller. Don't worry about giving yourself too high a dose. The PCA is safely set up by your anaesthetist.
Is it working for you?
Yes.
We really don't want your pain to limit your recovery. So if you are struggling, please don't suffer in silence. Just ask your nurse or doctor for help.
As per the ERAS protocol. Is that okay?
Yeah, that'd be nice to get out of bed.
If you push with your arms,
On the first day after your operation, it is important that you get moving as soon as possible. Early mobility after an operation can reduce the risk of you getting a chest infection, promote wound healing, stop you from getting blood clots and help you to get out of hospital more quickly. A nurse or physiotherapist will help you to get out of bed into a chair on your first day after surgery.
just feel for the chair behind you. And I want you to take a nice deep breath in for me through your nose.
It is also important that you take deep breaths regularly throughout the day to help clear any secretions and prevent a chest infection.
I do it that way.
If you do need to cough any secretions, then you can do a supported cough by holding a towel or pillow over your wound for comfort.
Day 1, you can have sips of water.
Depending on your surgery, you may start food straight away, or you may start with fluids only. Either way, you will be clearly advised what to start. You may not feel hungry to start with, but it is important to get going, and this will in turn support your mobility and recovery. When the clinical team feels intensive monitoring and support are no longer required, you will be stepped down to the ward for ongoing care under your surgical team. Before you go to the ward, we will remove some of the tubes and attachments so that you feel more comfortable and it is easier for you to move around.
So day 3, continue exercise.
On the ward, you will continue with your recovery process, following the daily goals in your ERAS booklet.
Good morning. How are you doing?
The surgical team will see you every morning. They will look at your drains, your wound, and advise you accordingly. If you have any questions throughout the day, write them down and ask the team the following morning.
So, in a couple of days.
The way you receive your pain medication may change. This could be in the form of tablets or liquid medicine. You may need to ask for some of the medications as extra if you are struggling. So if you are in pain, check with your doctor or nurse which medications you can have.
And so these are the exercises we're going to do today.
From day 2 after your operation, we encourage you to sit out for all of your meals and we will help you to start walking.
Your hands on the chair here.
Sometimes you will need support due to the attachments, but try to do as much for yourself as you can during your stay, like brushing your teeth and asking to walk to the toilet rather than using a commode by the bedside. Once most of your drains and catheters have been removed and the doctors are happy with your blood tests, we will start to finalise your discharge process. Therapists will work with you to regain your strength and mobility ready for discharge home. We expect you won't always feel 100% back to your pre-operation fitness, as we expect further recovery once you get home. If you require more support on discharge, we can provide onward referrals as needed. For your food and drink, you will be discharged once you are eating and drinking without problems. However, you may still have smaller portions, which is normal. We expect continued progression at home, in your own environment and eating your own food.
Alright, so we've got your medication for you.
When the whole team is happy for you to leave hospital, we will provide you with medications to take away and your discharge summary. Please organise your transport in advance. This could be a friend or relative to collect you. You may be transferred to the discharge lounge if you are just waiting for medications or for someone to collect you. When you get home, try to do your day-to-day activities as normal. Adding in a short walk each day will also help with your recovery. Remember not to do any heavy lifting for 6 to 8 weeks. Nothing heavier than a full kettle, or you are at risk of getting a hernia. Approximately 3 days after discharge, you will receive a call from the HPB CNS team. This might be slightly longer if day 3 falls on a weekend.
Hi, it's Gemma at the Royal Free. How are you?
This call will be to assess how your recovery is going since discharge from hospital, and will include questions about your wound, appetite, nausea, bowels, pain, medication, sleep, and mobility. However, you do not need to wait until this call to speak to us. If you have any concerns, you can contact us beforehand. You will have received the CNS contact details at your first appointment, and you will also have received a leaflet on discharge from the ward with other contact details if needing to speak to someone outside of our working hours. The leaflet also gives information about signs and symptoms to look out for at home. You will have an outpatient appointment approximately 2 weeks after your operation, which is usually face-to-face. This appointment is to check that you are recovering well and to discuss the histology of the part of your liver or pancreas removed.
I see that your recovery is going really well.
It also gives you an opportunity to ask any questions you may have. For cancerous conditions of the liver and pancreas, patients are generally followed up with surveillance scans at regular intervals, which will be explained by your consultant. For benign, non-cancerous, liver resections, surveillance scans and follow-up are not usually required.
Taken with a very good margin actually, so tumor is completely clear.
This is a lot of information to take in, so we encourage you to watch the video again and read any booklets you have been provided with. If you have any questions, please ask them during your appointments or give us a call.